A warm good evening to everybody, and we have with us our successful doctors, Dr. Neha Thakur and Dr. Yashita. And they have cleared their FMGE exam in January this year in a very first attempt and with very, very high scores. Warm welcome, Dr. Neha and Dr. Yashita. How are you feeling? Dr. Neha, please introduce yourself. Which place did you study your MBBS? Which part of the country you are in?
Yes, sir. Hi, I'm Dr. Neha. I am from Palm State Medical University, Russia, and I am from Himachal Pradesh, India. And I'm feeling very overwhelmed now. And I am very happy that I cleared this exam in my first attempt. And it was a very, very big dream. And I will thank Arise for their guidance, support, and all that I have now today. It's because of them. They play a very major role in my journey.
Really happy for you, Dr. Neha, and very proud of you also.
Thank you, sir.
Dr. Yashita, अपने बारे में कुछ बताइए. Which place you are from and which university you studied?
Myself, Dr. Yashita, and I recently graduated from Palm State Medical University, Russia, and currently I'm located at my home, Himachal Pradesh. And this was my very first attempt, and in this I scored 195, which I'm really grateful for. And exam was a bit of a roller coaster of a ride, but I would say that the hard work was consistent and I had the support of Arise as well. So I'm very grateful for these two things.
Nice. I think both of you are from Himachal. Do you guys know each other from before?
Yes, sir.
Yes.
We are friends since first year, roommates since first year, and roommates during the preparation too.
Nice.
Nice. And where did you guys study in Arise? Which branch of Arise you were in?
We were
in Delhi Arise.
Delhi Arise. Okay. And Dr. Neha, this exam is a crucial exam, right? Right at the time of joining MBBS abroad also, this is a major factor that is always there.
Yes,
to
sir.
take that decision and to pursue that with so much of intensity. And in an exam which is just a 30% pass percentage, when you were taking your first step, when you were trying to go abroad, were you convinced के करना है यहाँ पे ये चीज हो जाएगा? What was that motivation when you were starting to go abroad?
I wanted to become a doctor जब मैं छोटी सी तब से, तो I thought कि चाहे कुछ भी हो, I want to do this. Whether I have to put my 200%, 300%, I will give it all. So I went there with all the motivation I had, and and the little girl in me wanted that. So I just did it. And I did not thought many things that nahi hoga to kya hoga and all. I just went there at the age of 18. We went there, we grow up together, and then we are here together today. So I think we did it all.
Nice. I think from that little girl to doctor today and a licensed doctor, it's a great journey, Dr. Neha.
Yes, sir.
And Dr. Yashita, how was your journey throughout this process?
It was, as I said earlier, like it was not that too easy or not that too tough. But I was very young when I left the home. Like I was not even 18 when I left it. So, but I had many friends with me. Like we always stayed together. Like we studied even together and we partied together. So we did everything together. So this made this whole journey quite comfortable, because I really think that having a good company is a very big thing. And and even clearing this exam with my friends, and like very really happy about it. So yeah.
And दोनों भी इतना अच्छा स्कोर करे आए, 195, 200 marks in your first attempt. बहुत studious थे आप लोग यूनिवर्सिटी डेज में?
No, sir.
Everybody used to think, but we were kind of, we always believe like we have to do the smart work. Like these were university exams, and we have to study like according to the university's textbooks. And for the Indian exam, like we just thought that we are going to follow what Indian tutors told us. So yeah.
Something in your university days that you remember on par with your academics, or some journey that you remember about your university days, Dr. Neha?
Sir, we were in Ukraine before, and when war happened, we both transferred to Russia together, and we have to like put double effort in our 5th and 6th year. जब हमें preparation करना था FMG के लिए, we have to give all our exams again from 1st to 4th year. So it was a bit of a hard time, but I think Arise made it easy for us later.
Nice. And how was your experience in Ukraine? Do you guys miss Ukraine?
Yeah, we miss it too much.
Dr. Yashita, how was your experience in Ukraine?
So it was a bit good too because we spent most of our college journey there, like 4 years we were there. So it was really hard to leave that place. But Russia was very nice too. So then we had this major change in our final year. So it was quite difficult for us. Like we have to prepare for the FMGE as well, and we have to see our these previous marks from the previous university. So it was really hard for both of us, like how we are going to cope up with all this. But eventually we did, and we are here now.
Which university were you studying, both of you, in Ukraine before you came?
Sir,
Bukovinian State Medical.
Okay. And when did this FMG preparation start for you guys, Dr. Neha? Like, कब से आप serious थे? COVID था आप लोग के time, Ukraine war था. I'm
yes, sir.
not sure
Yes, sir.
how much time you could actually put in for this. कब से आप लोग लेके बैठ गए कि नहीं अभी करना है FMG preparation?
Sir, we did some subjects during COVID time, like I did anatomy and some of gynecology maybe, and a little bit of pediatrics. But when we got transferred to other university, we our time was way into other things. So we did not get that much time. In 6th year, I tried doing surgery, but I could not complete in that much of a way कि वो पूरा subject हो जाए. So then I went to Arise, and then I mainly started my journey.
Basically, you had some patchy work done.
Yes, sir, some patchy work done.
Yeah. And
but 90% of my preparation is during the Arise time.
Nice. And Dr. Yashita, how about you?
Yeah, sir, like same. I mainly focused on the subjects like, I did pediatrics and anatomy and a bit of a medicine. Like I didn't complete any of the subject. Like I did a bit of everything. So, but I would say that like the major subject, like some subjects were like untouched from my side. So I just focused everything while I was in my preparatory days, like at Delhi. So I would say, like as Neha said, like we both prepared each and every subject at Arise, like completely and fully. Like some few bits or some basics were done in our college years. So yeah, that's it.
Dr. Neha, coming back to your main preparation phase, like
Yes,
how did Arise Delhi come into your mind? Like why did Arise Delhi come into your thought process?
Yes, sir. So before coming to India, I asked my seniors, like, where should I go? Which will be the best academy? Like every academy, they promote themselves as they are the best. So I wanted to ask my seniors, so I asked for their guidance. And I also checked that the faculty in Arise is the best. And so I wanted to come here. And I also consult from my friends and other people. So they all suggested me that Arise offline is the best for you. So I just trusted them blindly and went there.
Okay. And this was a together decision. आप लोग first year से together थे.
Yes, sir.
And I
Yes,
think,
sir.
Yes, sir.
Okay. So वो friendship continued back in Arise Delhi. I think it's important also, right? Especially in that kind of stressful situation. Dr. Yashita, when you came to Arise Delhi, like this must be an intense phase altogether. Were you thinking this was going to be like this या ज़्यादा था? जितनी मेहनत करना था वो जो आप expectations lines पे था या ज़्यादा था?
So I was like fully prepared, like this is going to be a hell of a time. But Rice made it a bit easy for me. Like I didn't expected the monthly schedule which was provided. Like it was a very nice thing. Like after every subject, there would be like 1 or 2 days of off for the revision of the very same things because it's a very fresh information. So it will get very easily in your head. And after the very next day, there would be the subject test. So it was like an additional revision in our this whole revision process. So this thing I would say, like I wanted to mention this, like it is a very plus point. Like this might help most of the people because I was like very stressed when I started it. Like I was very scared, like what's going to happen? Am I able to even complete all 90 subjects or not? So yeah, but
I think following the schedule helps, right?
yeah,
So
it was very nice, yes, because each month it would be provided from Arise itself. So we didn't have to plan much. We were like, it's given to us, so we are going to follow this only.
Nice. And Dr. Neha, आजकल content इतना available है, right? There's much of content available for students, easily available also. Uh, how did you narrow down your preparation? Did you use multiple resources during your journey, or did you try to keep yourself limited to the workbooks that were provided for each subject at ARISE?
Sir, I limited my preparation to only ARISE notes. I read my notes 3 times. I revised it 3 times, and here I am. And I did not use any other resources. I did not watch any YouTube videos, as you told. Nothing. I only watched my TNDs and the teachers' revision video that are provided by ARISE, and that's only the thing I did till last.
And Dr. Yashita, did you mix and match any of the content, or did you stick to ARISE workbooks?
Like as I said, like it was my first time, so I didn't have like much thought, or I thought that I might be having some FOMO of like having no knowledge or something that others have. I just had this one thing very much fixed in myself that I'm going to trust my teachers, like whatever they say, whatever they have taught, I will do this only because this is very much enough for me. And plus, even the Q banks and the test series were also available at that Arise app. So it was, I think it's more than enough, and it was all worth it.
Nice, nice. And Dr. Neha, every student has a different learning style, and every student has a different faculty that they connect with. Who were your favorite memories that you remember when you remember Arise Delhi experience?
Yes, sir. I think Sir Salman sir and Priyan sir and you. Everyone is different. I know every student is different. And teaching a class of 500 and 1,000 people and engaging them all in books and keeping all them awake this time, I think it's very important. And Arise, all faculty is very good at it.
And Dr. Yashita, koi aapke favorites?
Sir, I would say one is the Sudha ma'am because she was the only female teacher was there, and I really liked her because ophthalmology was kind of not my much favorite subject. But when she taught me, I thought that ophthalmology is a very nice subject. And Priyan sir, like he made medicine very easy, and Prasanna sir because I really liked him from the his already from my previous preparation time, and you of course because you provided so many good things to us. So they were like everybody was really nice. I can't choose like a single one of it. I really appreciate each one of them.
Nice. And Dr. Neha, कैसा आप लोग कैसा पढ़ते थे? Like, would you write all the subject-wise tests with us? Did you attend all the
Yes,
classes?
sir. Sir, from the first test, we took it like yahi hai jo hai. It's the final. We took it like a final exam. So we have a schedule. Like we went to class every day at 7:30. We will be there 1 hour before the class starts. So we will get the seat we want. And uske baad classes arise mein, and we will be back by 6 or 7 in the evening. And after that, we took some rest, talk to our parents, and have dinner. Like 1.5 hour for that is enough. And after that, we will use to revise the stuff we studied today in the class. And after the revision, we used to be sleep. We used to be at bed by 9 at 1:30 or 2. And after that, we used to wake up at 6 in the morning every day. And we keep that routine till the end.
And Dr. Yashita, you had a similar timetable? I mean, was it on the same lines?
Yes, sir. Like, I would say, like, it was a bit easy to follow the same thing when we went home. Like, it was a very fresh information. Plus, we used to give each and every test, and like every single one of it, we gave it, and we used to like review it together, like which questions were wrong or which we have done it right or how we have done it. Some questions right when we don't even know what is it. So yeah. So we used to discuss the questions like together, which is very important to review the test and questions. Yeah, and we prepared the notes like which were written in the class itself. So we used to go home and we used to study together. So yeah, and we used to explain this to each other, like if we had any doubt. So
I think this journey of two Himachal girls being sticking together and getting this done through all the
yes, sir.
through all the
And I guess we were the only 2 girls from Himachal, only 2 people from Himachal in our whole batch.
ऐसा
Yes,
कुछ
sir.
टाइम याद है एक दूसरे को लग रहा था कि ये होगा नहीं होगा, सही जगह आगे क्या चल रहा है? एनी ऑफ
सर
दिस मोमेंट्स यू
रोज लगता था, रोज लगता था,
Yes,
एट द एंड ऑफ द डे रोज लगता था.
I
रिमेम्बर?
would add on this because this feeling, ये feeling हमको ज़्यादा, exam के पहले नहीं आई, exam के बाद आई, because the paper was, as we all know, like it was a bit on the difficult side this time. And we used to call each other every day and we used to discuss like each day a new question pops in our head, like, oh, that was the same question, this was the question. So what did you mark in this question? What did you mark in this question? And we used to say like, बस pass हो जाए, pass हो जाए. But we used to just think this
We only
only.
wanted 151 and that's it.
We're like, this is more than enough because the kind of paper it was like really stressful.
But I think you guys not just passed in style also, right? I say that
Yes, sir.
165 is needed to be able to be eligible for INSET, and you guys have done an amazingly good scores. And what was your stress buster, Dr. Neha? Like during the 6 months, I know how intense this is. No matter how much we try to make it easier, this is 19 subjects marathon that back to back students have to go through, and it's at a time requires a lot of effort, lot of intensity also. What was your stress busters? कब लेते थे आप लोग break studies के schedule में, और क्या करते थे उस time पे?
Sir, our break would be at the breakfast and also at the dinner time. 30 minutes in the morning and 30 minutes in the night. We used to watch something together while eating. And that would be the best part of the day, while having food and also watching something funny. We used to watch something funny, comedy. And I think that's the stress buster for me. And talking to my parents also. They give me a lot of confidence.
Nice. And Dr. Yashita, how important is test taking during this preparation?
Sir, I think it's really important, like not just only to test your, like it's the one first point, initial point is to test your knowledge, like what have you revised. But secondly, I would say the time management with the test giving, which comes like, Priyan sir once said in the class, like whenever you will give the exam, you will always feel like the exam is going very fast and you will feel that the time management is not taking the right place. It's not going as you have planned. And it literally happened to me in the exam itself because while I was giving the test, kabhi bhi mujhe like aisa feel nahi hua that this time is not enough. Like I have done it like before, jab at least 15-20 minutes, so there would be there to revise or to go through. So test giving is very important. Firstly, it will help to review your knowledge, and secondly it will sometime it will help you to through the doubts which you have, and thirdly it would be really nice for the time management. So these all things are quite important for the exam as well.
And Dr. Neha, at Arise we do this 3-part training. Initially 90 minutes का पूरा theory होता है, workbook based discussion होता है, बच्चों को हम independently MCQ solve करने के लिए, Q bank करने के लिए कहते हैं. Then we move them into a completely MCQ mode, जहाँ पे back to back subjects होते हैं. And towards the end you have the quick revision program, fast track program. Did you take utilization of all the things, or were you?
Yes, sir. I did utilize all the things. When there was classes, I give every test and I review every test, and the mistakes I made in every subject-wise test, I tried that I will never make that mistake again. So it will be a plus point for me that if I made 100 mistakes, then it will be 100 topics plus for me. So I kept that in a way. And after you said, हमारी जैसे क्लासेस खत्म हुई थी like 18 November, and the next day we had physiology test series started. So जैसा राइज का schedule था, I followed the same schedule and I tried to revise the subject before the test in a test series, and I revised every subject and I gave every test series test. And GTs, I gave 3 GTs, and in the first GT I think I scored 170, and after the second revision, the second GT of Arise, I scored 204, and in the third GT of the third revision I got 186. And I only gave 3 GTs. I reviewed them. I review every test, and I also want to highlight that the schedule schedule that Arise had provided, it was the best. I think it was the best part of my preparation, that helped me to stay consistent. And One thing I also want to tell everyone, that you should learn from your mistakes. That's the best part about it. If you do a mistake one time, and I'm sure that nobody's going to do that again if they review it again and again. So that's the best part. And I also want to say that you should practice more and more questions. I still remember in this, when there is the test series has started, you told us that you should spend 80% of your time on your notes, revising your notes, and the 20% of the time on PYQs. And I did the same for the preparation. I did revise my notes till the end, even till the end, till the last day of the exam. I did my notes, main notes of the arise.
And Dr.
Yes.
Yashita, please tell me how was your test taking? जैसा ही क्लासेस हो गए थे, फिर उसके बाद में जब शेड्यूल देते हैं हम बच्चों को, दे फाइंड के भी एक दिन में कैसा रिवीजन हो जाएगा, 2 दिन में कैसा रिवीजन हो जाएगा. तो there is a lot of this thing. How did you manage or fine tune your revision to match the schedule?
Yes, sir. Like as you said, like it is a bit difficult, but ये easy हो जाता है जब as I said, like the subject wise when the tests were there, one revision was done at that time only. Like a bit or few topics must have been which were left. So I would say, and plus उस time पे like Priyansh sir also advised one thing, like if it's important to complete that time, so jaldi jaldi padho. So like we have to and if we do the same thing like 2 or 3 times, like if we do the jaldi jaldi wala thing 2 or 3 times, it was quite nice because aisa karke like most of the subject was covered. I agree, like sometimes we think like how can we cover the subject in 1 day or 2 day, even like 2 subject tests were on the same day, like the smaller subjects like psychiatry and this forensic and all. So we were really stressed, like how are we going to complete, and few topics were like I agree kuch na kuch reh jata tha hamara. Like we used to think, like we used to ask each other like tera ye ho gaya or have you left it as well. So we were like ki ha kuch na kuch reh jata hai, but it's like ki once we review the exam then we didn't went to the next one. We were like ki firstly we will complete this one only. It will hardly take 2 or 3 hours of the next day. So we applied this thing.
And Dr. Neha and Dr. Yashita, you must have seen lot of students in the classroom. There is a huge intensity, right? All together, it's very different from your university lives, the relaxed, life. What have you observed? Like, what are good students doing, and what are the students who are finding it difficult to clear? Some mistakes that you would say that students should avoid. Some distractions that you feel students should, avoid during that preparation phase.
I would say like, one very major mistake that I have observed, even I used to believe the same, used to think that these bigger subjects like the medicine, surgery and gynecology, like these are the very important ones. So many students do one thing, like they give their 50% of the time to these subjects only, and they just underestimate the smaller ones like the another clinical ones like radiology, ophthalmology, ENT. And when the teachers told us the other thing, like these smaller subjects are much more important because the bigger ones are very vast subjects. So the examiner can do anything with those questions, like he can trap you anyhow. But these smaller subjects, they are like a bit good ones because they're quite easy and they're quite good, and they will help you to score better. So this thing like changed my mentality very, this affected me very well, and I just focused on each and every one of the subject. I'm not saying that these subjects are not important at all. Many students underestimate these smaller subjects. So I think this is the one major mistake that students are making.
Completely agree, Dr. Yashita. You kept it so nicely that the focus going only on to the major subjects and completely ignoring or sidelining the other subjects, thinking कि भाई इसमें 30 marks आ जाएंगे, इससे हो जाएगा मेरा 150 मेरे को इसमें हो जाएंगे, and that is where the whole gap starts in. And I think and Dr. Neha, anything from your side, like based on students' observations, कुछ लगा कि बच्चे सिर्फ कभी-कभार
I
MCQ
think people do not do enough MCQs and they start at the end of the time, and which is very wrong. I think they should start from the first day, at least 20. Like they should follow the schedule if they are having the pediatrics or maybe dermatology. So I think after the class, they should revise the content and do MCQ at least for 20 minutes. Start from 20 minutes, start from 10 minutes, maybe 20 a day, 30 a day, and then start increasing it till the end. And I think जब आप करते हैं ना क्वेश्चंस, तो जैसे आपने एक टॉपिक पढ़ा है तो आपने उसके क्वेश्चंस लगाए, तो मे बी 10 क्वेश्चंस, मे बी 20 क्वेश्चंस, तो यू शुड, तो आपको आइडिया हो जाता है कि अगर इस टॉपिक से क्वेश्चन आएगा तो इट विल बी पुट इट इन अ वे, दिस वे। तो फिर अगर जब आप नेक्स्ट टाइम क्वेश्चन करते हैं तो इफ इट इज फ्रॉम द सेम टॉपिक, तो इट विल हेल्प यू if you solve the same topic question before.
Agree. Starting MCQ practice much earlier, along with your subjects, theory के साथ ही,
Yes,
class
sir.
के साथ ही करना शुरू कर दो.
Yes, sir.
And how many questions per day should I do to get 190, 200 scores in my first attempt?
Sir, I think you should do at least 100 to 150 question must from day one. You should take every test seriously, and you should practice everyday questions enough.
So to all the listeners, if you want to also get 190 plus and 200 plus in your first attempt, 100 to 150 questions per day. I think that is a good advice also. Were the questions very different? आप लोग इतना अच्छा score भी करे हो. Were they very different from whatever tests you have done, GTs you have done? What is that experience that was different?
I think the PYQ, they were in a very different language. And when we study there, it was a 5 lines long question, and you have to study it again and again and again, and that will take time for it. And it's a very different language. I think we should learn English too. When I saw the exam, I thought I
And
had it
Yashita, your
20th
experience.
subject too.
Nice.
Yes, sir. Like in exam, like, you're already very stressed, or you have that anxiety that, yeah, this is the exam or these questions. So we already like find it very difficult to, even read the question. Like some questions are even easy, like we even know them, but sometimes we are in such a stress or in such a hurry, like we even like think like, do I even know this? Like, am I marking the correct answer in this or not? So it's like that. So it's like, as I said earlier, like time management is a very difficult thing, which I think most of the people are going to face it. But I'm just not saying it to scare it to anybody.
The
But
more
I'm
you
just
practice,
saying,
the more you can handle the question.
yeah, yes. Sir. So it's just like you should practice as much as you can. So it is eventually going to pay off.
Results के दिन कहाँ पे थे आप लोग, डॉक्टर नेहा?
So I was at home. She was also at her home, and she called me that result came. I didn't knew, and then I checked, and I couldn't believe that I got 202. I checked it again and again. I think I checked it almost 10, 20 times. Even then the scorecard out, then I was sure ki, yeah, I was passed.
मेरा ही नंबर है, मेरा ही नाम
Yes, sir.
हुआ है.
Yes.
Okay. And Dr. Yashita, like, what was the first feeling that went through once you, and were you guys, I mean, आप लोग बोल रहे थे recalls के time पे there was always this apprehension. So
Yes, sir. Because sir,
did you
recalls के
knew that
time
you
पे
would
ना,
clear? Did you knew that you would clear?
sir, I would not say that क्योंकि हमने कोई भी recalls नहीं देखे थे.
We were too scared to watch it.
And what was the sense? I mean, what was the sense of at home, and like, it's a big decision for the family, parents especially, and right, young girls going through so much COVID, Ukraine war, Russia, you went through a lot
Yes,
of
sir.
things, and finally all that sense, all that makes sense and happiness, right? What was the feeling at home?
They believed us. I will say they believed in us. They told us that you are going to pass. We knew that you are going to pass. And I said, ki, I only want to get 151, and that's enough for me if I get that. And if I didn't get that, then I'll prepare once again, because I have to do the hard work, and I can do that again too if I have to.
Really inspiring, and really happy to listen to your journeys and all. And what have you guys been doing since the results day? क्या कर रहे हैं आप लोग? Dr. Yashita.
I'm just enjoying my me time at my home. I'm just working on myself. I'm like workouts and skincare and just some shopping or something. That's it. I'm just doing this only and some binge watch. That's it.
Nice. Any advice? Like, a lot of these videos, these interviews that we make is mainly to give some, direction to the juniors. And there are two types of juniors who will be listening to you. And I would want a more honest approach, like एक senior की advice junior के लिए. There are so many students in perm. There are so many students in the universities, juniors जो अलग-अलग आप लोग की यूक्रेन यूनिवर्सिटी से अलग-अलग जगह आगे पढ़ रहे हैं. Some in their second, third year, some in their final year. What would your advice be to your final year students, and what would your advice be to the juniors? Dr. Neha, from you.
Yes, sir. So I think they should start early. because the level is increasing day by day. And I think exam is becoming a more of a clinical and conceptual. So I think concepts is a very big thing. So you should clear your concepts and basics. They are going to help you mainly. And also, if you are going to take this step, like start from early, I think you should join a app or an academy like Arise, I would say. And you should follow the schedule blindly, I will tell them. And practice more and more MCQs. And I think that will be gonna be enough.
Okay. And Dr. Yashita, any advices, something that you would say that you would wanted somebody to explain you when you were joining
Yes,
first?
sir. I would say like in university time, you can start your major subject, like the bigger one, because you have like pretty much enough time. Like you can go in the depth of those subjects. You can study as much as information you can have. But in those 6 month time, you don't have that much time. This that you can give it all to just one subject. So I would advise that the major subjects you can follow in your university days, but and in your coaching days, as I earlier said, we have to pay attention to each and every one of the subject, because these smaller subjects are the very good ones, because they're very easy. Firstly, they're very easy to learn. And secondly, they are not only giving you that slight possibility of passing the exam, they will help you to score even better. And like exam is like no more of a, it's not following the same pattern. Like anything can happen, it's like changing every day, so we can't underestimate any subject. We have to study each one of it, and we should do MCQs as much as we can, and we should be very serious for at least those 6 months, because they are going to pay. Because I myself have seen many students who are like there, and it's like not even their first, or it's like some many another times, but they're not that much seriousness there is in them. So I would really advise that if you be very, engaged in yourself and the studies for just 6 months, it would pay you off very nicely, and you should follow every subject.
That's a good advice. Like look into your major subjects when you're in your university days. आप जितना मेडिसिन करना चाह रहे हो, जितना सर्जरी, जितना ओबीजी, जितना पीएसएम आप करना चाह रहे हो, आप अपने यूनिवर्सिटी डेज में खत्म करो. फाइनल ईयर तक भी आप जितना टाइम लेके, इवन पीपल नाउ हु आर लिसनिंग, हु आर गोइंग टू कम बैक इन जुलाई, this is the months that you can actually invest in your major subjects. And once you come back, focus on covering all the 19 subjects with the schedule that is going to be given, and that will give you more output. I think that's very well said, Dr. Yashita. I think giving a lot of time and effort to the major subjects in your final years, in your university days, actually helps you understand better also. But once you come down here, don't do too much of depth in those subjects, and stick to what is being taught and in the classes. And both Dr. Neha and Dr. Yashita, they have told that they have stick to the workbook so thoroughly, revise the same day, been part of the Q question solving, 100 to 150 questions on a daily basis, attending all tests. And students make a lot of complicated decisions, lot of complicated thought process for a straightforward journey. I understand it's a 19 subject thing, and there are so much things going on all around you. But if you can cut out all that noise and focus on what is there in your hand, and believe in the process, trust the process, and stick to it, and implement that in your preparation. And really happy, and really proud of both of you, the kind of journey that you guys had together, and the kind of bond you guys share, and the bond that you carried through this intense preparation phase, and coming out as doctors in your first attempt means a lot to be able to be part of your journey at Arise. I hope you'll remember Arise for a long time, for the learnings and the kind of environment that Arise had provided you. And we'll be happy to see you all flourish and become the most responsible doctors for the country, and the kind of inspiration that you guys have brought in with throughout the journey, right from Himachal, and then through COVID, through war, to different university in Russia, coming back and clearing in first attempt with such high numbers. I'm sure a lot of students would take this as a very inspiring story, and we wish you a lot of success, lot of laurels, and a lot of good work, and a bright future for both of you. Okay, best
Thank you
wishes.
so much, sir.
Thank
I
you,
also
sir.
want to thank you for this journey. You are a very big part of this journey. Without you, it's not gonna be possible. And I still remember 𝗲𝗍 class say, it was the second day of your class, and you told us ki the people who are sitting here till second day, I know they're gonna be till the end, and they're gonna go through it, and they will make it. and we made it. Thank you so much.
I'm really, really proud of you. Okay. God bless you guys.
Thank you so
Take care. Thank you so much.